Page 1, you see the abdomen. Mainly you studied TCM, am I right? Mainly, no. Well, anyway, for me it's very important to palpate abdomen. Originally, it come from China, Nanjing. Abdomen. Heart reflex, which is below the sternum, and Nanjing say the right side of the navel, which we believe around the stomach line area, it's called lung reflex, lung. And then below the navel, tantium, which is kidney reflex. Okay. Left side, Nanjing say liver reflex. Okay. And then around the navel, spleen reflex. Is that okay? So, how many people poke abdomen? Oh, really interesting, huh? No, how many people palpate the abdomen? Is that right? More? Why? I mean, not why. You palpating this way, or you palpating moo point, or?
It's pulse.
Blind pole.
We learn from Paul.
You. More than the 80% maybe. Interesting. Okay. I erase now. Well, if you look at my picture, it's more than the five element area. You can see more. Well, anyway, let me start to explain a little bit. If you start to palpate abdomen, you will find out very common. You can find, according to my practice too, stomach 26, 27. This is not good. Like this way, stomach, and the kidney, 15 areas. Showing in the left side, which is liver reflex. This is one very common. I see 90 to 100 patients a week. More than the 70% have this pain by poking. You can see other side too, but that's one of the, that's more lung side, but we call this one, we call oketsu. Stagnation, oketsu is well, it's stagnation blood, but stagnation blood, if I say that, people confuse with TCM, chop pulse. So I don't use the same words because chop pulse theory is not related to the abdominal diagnosis anyway. They find by pulse, right? So to not confuse, I have to use Japanese words, but the same meaning: stagnation blood, congealed blood, old blood, and if it's hardness there, you know, like it's very different. Is when you palpate, patient say pain or ow, you know, is not the same as I feel hardness. Okay, if I feel hardness, it's called oketsu kai. Kai is like a lump, you know, like a substance. There's something there. Do you know what I mean? So it's important for me because oketsu get chronic oketsu stagnation blood become chronic, or its accumulation turn to the oketsu kai. You know what I mean? Means this is oketsu kai, which I feel lump is more chronic. Okay. Only pain, patient say, I don't feel any substance. You know what I mean? Only patient say pain, but I don't feel anything. That is oketsu, and for me it's much easy to clean up. Is that clear so far? Okay, you can see the mechanism of the oketsu. There's many theories. By the way, originally it's come from below the navel stagnation blood theory came from Shanhan Lung herbal book. I think you know the name of the Shanhan Lung. They use different words. It's like piling blood. If you know the characters, it's called piling blood, like accumulation of the blood, which stuck below the navel. You know what I mean? It's, like upper is more easy to move, you know what I mean? And if you think about the whole, like jaw, lower is more stuck easily, do you know what I mean? So originally come from Shanhan Lung, they say, if you have piling old blood, originally clean blood, but if it stay there for a long time, it get stink and dirty and cause it become toxic, do you know what I mean? So we care about the toxin. Does not matter patients come headache or allergy or bladder infection or pneumonia. Does not matter if I find this, I have to clean. Do you know what I mean? Because this is poison. Is it okay? By the way, if you look at the indications and the etiology, you can see so many people higher chance to get, for example, anybody who had 3-4 operation. Does not matter that 20 years ago or 30 years ago. In America, you see lot is a C-section twice before appendectomy, and then gallbladder remove. Also the facelift? Oh, facelift, okay. Facelift. Well, also I see many light skin people have a pre-cancer cell. They cut and sometimes dig. Do you know what I mean? So it's like I can see tiny scar there, tiny stitches there here. So if it's more than the 3-4 operations in their life, okay, doesn't matter the operation appendix is age 10 or 20, okay? Does not matter how many years ago. If you have more operation, more higher chance, because you know how many chemicals they use during operation. And also, oketsu develop because of the bruise, the punch, hematoma. Hematoma later on carry, doesn't matter hematoma is face or buttock, okay? It's come to here, okay? And one more is very common is intensive heat. For example, patient say I had a high fever and lie down on the bed for 10 days or severe pneumonia or influenza, flu. Then they come to see me. They already developed this. So, are you following? Okay. Yes. Question.
Did you say that when you actually palpate, that's why
like I say, oketsu is a patient tell me, ow. Then I feel something a little bit, but oketsu kai is a accumulation of the stagnation blood return to the hardness. Like some people like lump there. Lump, hard. When you poke abdomen, best abdomen is you have enough muscle, solid, not flabby, and when you palpate, no lump, no tight, no, has to be nice solid muscle, isn't it? But some areas harder or colder or muscle separatable feeling or is that clear? Oketsu Kai's lump, accumulation of oketsu, is okay? So I'm explaining why people develop, okay? Anyway, like Bruce, so if you have lots of sports, higher chance to develop this, right? Also, very common, I see the infection. For example, ear infection, sinus infection, and many women have bladder infection. Again, with antibiotic, this will be worse and worse and worse. Do you know what I mean? Maybe location of the infection is ear, throat, sinus infection, bladder infection, vaginal infection, doesn't matter, okay? If you have infection, you know what I mean, with antibiotic, combination together, this gets worse. Is that clear? You know, so it's important, it does not matter any reason they come. I find I have to treat because this can be the toxin and this creates other problem. Is that okay? Also, it, you know, taking medicine, like for example, Prozac, here too, if you ask my patients, it's 20-30% of my patients taking Prozac. And also, maybe 10% taking high blood pressure pill. No? Also, women, thyroxine. Right? You know, it's, they don't even think about, oh yeah, I'm taking thyroxine 10 years or Prozac 20 years, you know what I mean? So if they taking the medicine, accumulation makes this too. Is that okay? Some people taking 15 or 20 drugs, you know. Right. Well, also like I say, operation, I care about why they cut, why they have to have the operation at the time. For example, this person have this kind of scar, right? What happened, right? She say I had cancer and I the oral hysterectomy. Okay, if I find this and the patient say or complete hysterectomy, like ovary gone, uterus gone, I care no matter any reason they come. I care because once you lose something, energetically big change. Okay, gallbladder remove. Well, they used to cut like this, right? Now they cut the navel here, chop here, tiny bit here, hole here, you know what I mean? But that's really new. If you are patient like 20 years ago, they cut like this. You know, only this 4-5 years in America, laparoscopy style. But if they say I have gallbladder removed, then I have right shoulder pain or right headache. It's very important. It's related to the organ you lost. Okay. I'm not saying anywhere, but okay, this is important because 10 years, 20 years later, maybe 5 years later, doesn't matter, they may develop something because once you lost. Western medicine, gallbladder is not so important, right? But for Chinese medicine, gallbladder is one of the 12 organs, isn't it? You know what I mean? This is like, if you have it, you don't appreciate it. But if you lose, you find out, wow, the right neck pain, the right headache, or indigestion start, or I cannot eat oil grease. Once they lose, they find out how important thing I lost. Do you know what I mean? So one more is ovary. In America, 1 out of 10 women over 55 years old, they don't have it. Well, like many reasons can, but doesn't have to be cancer. Before fibroid, they took whole thing away. The kind of people still living and come to my office, you know what I mean? But the 1970, 80, they did a lot. Or you have 3 kids, you don't need ovary anymore, you know, it's, take it away, whole thing. You know, do you know what I mean? When they did, fibroid, they can take only uterus away, but they took whole thing away. So these people, after operation, they come to see me, bringing some different problems, and they don't think connected to this, because it's not happened right after. If you had operation and the next day you develop the sciatica, which you never have, you start to think it's connected to this, right? But if 3 months later or 1 year later, they don't think like that. By the way, if you cut around the navel area, very common allergy get to us. You know that's also another common place. They take a look inside. For example, fertility problem, they want to see inside, right, ovary. They make tiny, teeny hole, and they stick the, you know the, what's the name? Laparoscopy. Laparoscopy, very common, not the next day, but next year, the sinus allergy gets worse. If you cut the navel, and this is one scar, it's not easy to heal because inside of the navel is not muscle. Inside of the navel is ligament, right? Ligament, when you cut the ligament, less blood coming than compared to the other parts. Less blood, therefore, it's not easy compared to cut the muscle. Do you know what I mean? Question?
What about people who have a spot in the navel?
Huh?
A ring in the navel?
You have patients after the pierce next year, sinus allergy get worse. Only one, no? I say, could you take it away and let me check? But do you have a patient like that? Yeah, I don't recommend. Are you thinking to do in the future or no? I don't recommend the.
What she's trying to say is that if you cut the ligament and compare it to the healing of a muscle, the ligament heals a lot slower than muscle or other tissues. Therefore, you can have much higher possibility for infection, and therefore you can create a much stronger opening. So it takes a longer time. Basically.
Also, next another organ, ovary remove, kidney deficiency start. Kidney deficiency. You know for us, ovary belong to kidney, uterus belong to the liver. Okay, so if you cut the ovary away, it's hormonal problem start. Maybe she has before, but also get worse. And very common, if you lose ovary, thyroid get weak. If you look at the whole kidney channel, you land like, start from bottom of the feet, rising up, and from groin go to the kidney, right? And the front one, from kidney 16 goes inside and surround the kidney, adrenal, ovary, then come back, then rising up again, past the lung reflex, then surround the whole ground, right? Like thyroid, parathyroid, and tonsil adenoid. Do you know what I mean? Salivary glands, all glands belong to the kidney. So if you lose one, which balance gets out, and very common later on develop the thyroid problem or parathyroid hyper. Like, if you lose this, you have to worry about the bone problem in the future, right? Anyway, for me, if they say I cut this here, my ovary gone, especially 2, it's 1. Right, if you have both gone, kidney deficiency, that somebody lost ovary, that doesn't matter, nobody. Because it shows very clearly, nobody. Okay. Anyway, it's maybe we have tomorrow, but it shows very clearly some place this we have to do this is like one pattern. Do you know what I mean? Nobody, okay. Well, anyway, I teach later tomorrow about gynecology because losing ovary is a big deal. Okay. They come later. No, don't you have more women patients? No. They after the something losing here or chopping here, then they come to see you after that. Doesn't matter. The reason is sciatica or you know what I mean? Energetically lose balance, then they develop migraine headache or does not matter. This is one of the important deal. You know what I mean? I see abdomen, if they lost, no matter what they complain, it's very important to tonify the kidney first. It's lost, it's gone. So I have to do something like replacement treatment.